welcome to another series of patient and provider. I, I have to stop saying patient and provider. It's now more like personal expert. I consider you, Teja, becoming an expert and teaching us all about functional health. So we're partnering personal expert and provider in this conversation, current treatment options, current care and treatment options for functional, and we can talk about functional neurological disorders, but we can also broaden the topic a little bit to include other functional illnesses if it appears in our minds. If we decide, remember, I always say it's an umbrella, then you have FND, but then you also have fibromyalgia, irritable bowel syndrome, you have functional chest pain, and all these other things. So let us see what comes to our minds. But Teja, it has been a while. So remind us, what are you doing currently? Personally, professionally, studying? Where are you in the world? Tell us all that.
I'm still currently in England. I'm Teja. I was diagnosed with functional seizures when I was 17, and have lived with FND for about 5 years now, and have found kind of on today's topic, there was a shortage of care that was effective and helpful. And so once I started to recover, going into more advocacy work, so I work with the research team at FND Hope. I was the research coordinator for a while, and I'm also getting currently in school to do pharmacy school and become a pharmacist. That's kind of separate in my own interests. And yeah, I love to write music, and I'm very passionate about pediatric care because that really influenced my access to care. So I work a lot in addition to research with kids with FND, and just showing them that there are other humans with FND as well. I think it can be really important to some patients, especially younger patients that don't have that access or visibility.
Thank you so much. You already said some key words that caught my attention, and maybe we could start with that. You mentioned for 5 years you have been trying to get the best. We always want to get the best care possible, the best treatment. So for 5 years you have been exploring, okay, what is out there? And you mentioned shortage of care. Can you give us a little bit more detail? And I can give you also later my perspective from the professional side. What do you experience that is happening with this shortage of care? How is it manifesting at a personal level?
I think it's twofold. It's shortage of care, but also shortage of effective care. And so even those who might have access to treatment, whether or not it's effective for them, there are a lot of outcome studies that do indicate current treatments that are like quote unquote first line don't always have the best outcomes long term for patients. But for me, what that looked like is I was diagnosed at a children's hospital, and I had already received care there for a separate condition. But their basic treatment advice was essentially continue life like normal. So the least amount of attention you can draw to symptoms, the better. And then that was it. And then for me, it just felt very dismissive of that this isn't my normal life, right? So prior to the F&D development, it was during the pandemic, but I was involved in a lot of organizations. I was a varsity swimmer. I was in musical theater. I was taking a lot of advanced science classes, and I was overall very happy. And obviously, in retrospect, I can see things that led up to the development of FND. But once I had FND, my ability to do those things was completely overruled by the symptoms that I was experiencing. So for someone to say, "Oh, just live like life like normal," it's like, well, that's not feasibly possible. And so I just kind of deteriorated from there. And they gave like a number to a mental health hotline, for which the wait list for like access to referral was, I think, 6 months. And when we finally accessed the call, they just had never heard of FND. So it wasn't even that like helpful of a referral. Um, it was a pretty hard period because no one would take me because I was under 18. Um, and so ultimately, what ended up happening is I was very privileged in the combination of having the pandemic. So my parents were working remotely, which in of itself was a financial privilege that my parents' jobs were able to be moved remote during the pandemic, and that my brother and I's schooling was remote, and that my family was able to afford to go out of state for 6 weeks and kind of rent an apartment. And after a lot of work, and I'm talking like tens of hours on phone calls on my parents' part, in addition to caring for me, and I was like definitely needing a lot of personal care at this point in my life. Um, we ended up going to out of state, and I was in kind of an intensive outpatient treatment where I was getting treatment every day. And that for me was extremely effective in what I needed. And um, it was it also helped me understand what FND is in me and like kind of why I experience the symptoms that I do. I've met a lot of patients with FND. I don't believe the answer is the same for every one of us. So that to me was like an integral part of my care, was kind of understanding FND in myself and kind of building more regulation and awareness of when I was slipping out. And that care was in the short term very effective, but like I said, it's been 5 years and it's been an ongoing process of finding things in myself too. It's not also just on the care team to find effective care. It's also at a certain point instituting these things in day-to-day life, and it can feel exhausting and unfair. And it's easier sometimes to not want to have to do this work and to not constantly be checking in with yourself. But I'm aware now. I recently celebrated 10 months seizure free, which is the longest I've ever been. But I'm under no delusion that I don't have FND, right? To me, that's like an everyday thing. And that I've noticed that when I start to gain more symptom relief for longer periods of time, it's easier to forget the regulation work. And so that to me is also important in my care that I do as an individual and less is on the provider. But yeah, I think my biggest takeaway is the amount of privilege it took for me to find that care is something that, and circumstance, right? Like the pandemic made it so everyone was working remotely, um, is just not feasible for most pediatric patients or even adults have similar experiences. And it's just not something that's equitable in any way or reasonable for families to be navigating when they're really sick. And so that's part of my advocacy work is increasing educating clinicians so that there's more clinicians that know how to treat FND effectively, even if it's not their main specialty, and just access because someone shouldn't have to move halfway across the country for 6 weeks to get care. It's incredibly expensive. It's incredibly difficult to coordinate.
Exactly, exactly. And I even wrote down some of let's see, from my perspective, it's not enough people, not enough providers know about functional illnesses. And let us remember that it presents to all subspecialties in medicine because we have an entire body that functions and can malfunction. So we can have cardiovascular, gastrointestinal, musculoskeletal functional symptoms. So it really goes to all providers. Education is key. There are not enough providers that know how to treat it. Many providers are scared, literally scared of the unknown. And,
Yeah.
and this is something that is very easy to solve with education and understanding. Um, and then the things that you said, for example, like, oh, don't pay attention to the symptom. When you and I study and my pathophysiological integrative model is, well, when you're hungry, your belly gives you a signal of hunger.
Yeah,
When you
the
right,
opposite.
this exactly, it's like
Yeah.
this is the
Yeah.
most basic thing in human functioning. You have to
Yeah.
you have to listen to your body, right? And
Yeah, it's quite
so
ironic. Yeah.
so wrong, like
Yeah.
so basically fundamentally wrong what they are saying out there. And then other things like not diving into the causes. For example, often we have very busy lives that keep us busy and engaged cognitively, and we may override the body signals of rest and fun and relaxation and the pleasures of just like getting a massage and sleeping, right? So we may overlook these things. These are relatively simple causes of FND to correct. It's like, okay, well, listen to your body. Maybe it shows your energetic balance and things like that. So the system, it's very flawed. I think the solutions are rather simple education is something that we can all do. We have a mouth, we have eyes, we can go around teaching and interacting. So, what are you currently doing? What do you see happening out there from your perspective as studying, volunteering, engaging in with F&D Hope? What is happening in terms of comprehensive care? Because you already said quote unquote first line. We have a lot of first line modalities that are not doing their job. So what is happening around comprehensive care that gives care, attention to mind, cognitive mind, emotions, physical body, autonomic nervous system inserted in society? What is happening out there, Teja? And you can tell me what are you doing also around
I think,
this?
to be honest, one of my biggest frustrations is, so I work in the research department of F&D Hope, so I help screen studies, but then I also work as a PPIE. But then I also do a lot of patient-facing work, and I'm seeing an immense dichotomy of research is advancing that is showing kind of targets for FND treatment, really emerging FND treatments. And this is the same with any condition, right? But I think it's maybe I'm especially feeling it because I know the impact, because I, was experiencing severe FND symptoms at one point, and I'm working with the people who are having them. And it's taking so long for these patients to experience the benefits from the excellent research that's emerging right now. And it's really frustrating for me as an individual to be in both rooms and to just kind of want to give access to all of these promising like treatments, but also, there's also a lot more understood now mechanistically about FND that gives a lot more room for like new treatment interventions that could be targeted now that we're looking at those underlying mechanisms. But it is really hard for me as an individual to sit in both rooms and not sometimes want to give up, because it's so hard when I have FND patients who don't have anyone in their state that treats FND. And so they're kind of left trying to navigate it on their own when I know that there is a world in which they could be getting access to care that is effective. And another thing that I have found kind of frustrating, and this is not necessarily a commentary on research or the clinicians or even the treatments that can be effective, but the limitations of healthcare systems in that clinicians don't have necessarily the time or resources to give care that is individualized, and that can really meet complex patient needs, because FND patients tend to have other physical or psychological comorbidities. And I have noticed that, if you look at CBT, it's effective for some patients, but having every patient do the same workbook really doesn't individualize to who they are as a person. And FND is very heterogeneous. And so this is not me criticizing CBT as a whole, but just this stamp that everyone with FND gets it. But I think one of the reasons that has been happening for as long as it has is because it's very resource friendly, right? You train a clinician to go through one workbook, or maybe a clinician's not even involved. Like I know a lot of patients who are just sent home with it and left to do it on their own. And while it might seem simple, these things are not simple for an FND patient that might struggle with things like interoception, right? Listening to your body is very easy to say, but it's very hard to do if your body doesn't feel like a safe place. And so my issues, like I think that I'm noticing with care right now is not lack of excellent research, but getting it in a place where one, clinicians can be trained on it, and two, that the healthcare systems are not necessarily built to put them into practice, because a lot of F&D care needs to be so individualized. The irony is it's very inefficient, even if it seems more efficient to just have every patient do the same workbook. If you look at cost, right? If a patient's not going to get better, and I'm not talking about from an emotion perspective, but purely like financial, they're going to keep coming back to your emergency room, right? And that bed needs to be taken by, someone who has a condition that can be treated in an emergency room, which we know is not true for FND or functional seizures or functional symptoms. But yet there's still this dichotomy with outpatient resource allocation. And so I am finding it harder and harder almost to do the patient-facing work, because it's so hard for me to not see the work that I'm doing outside help them. And I know it takes time. And I am aware of the amount of progress made even in the last like 5 years since I've been diagnosed, but it sometimes feels like a futile battle. But I think it just takes time, but it is immensely frustrating, to be honest, as someone who's more emotionally invested in the research because I want it to help people right away, and that's just not how processes work.
Yeah, this is something that in medicine has been known for a while. I think even a research study showed that it takes about 20 years
Yeah.
for a modality to come out of the laboratory and be implemented at a global, national, or international stage through guidelines, right? Like these
Yeah.
international guidelines of care. About 20 years. You know, Tisha, I'm an optimist. So I think that if we understand these mechanistic points of this function and we target them in all networks, cognitive mind, autonomic nervous system, emotions, and physical body, somatosensory connections, individualize, I think we can do personalized care. This is what I do within a mechanistic general supported by science methodology and frame. Uh, the model is not that complicated. I mean, you and I have done it together, right? It's pretty like free flowing. Like, what are you feeling here and there and there? I have programs where I am teaching it to physicians and I am teaching it to patients and I do group classes and I do individual sessions and people learn it. It's pretty simple because it's just human function. Now, medicine is also, it falls under a business model too,
Yeah.
right? Like you have demand and you have supply and you have to offer, right? And then you need to keep resources and right. And then you're offering services and clients need to be satisfied. So especially in the United States, other countries of socialized medicine is a little bit more social and less capitalist, but it's a business model
Well,
with a
you still have limited
capitalist.
resources.
I'm sorry, say that
Oh,
again.
sorry, I was just going to say, even in socialized models, you still have a set finite amount of resources. So you still have
Yes,
that
yes.
same limitation, right?
Yeah. So we have the capital component and we have the social services that we want to give. So we can look at it as a business model. I'm trying to think, looking at it from a purely business perspective, how can we teach? I'm in the teaching business, let's call it this way. How can we teach at a larger scale what is happening in research, all these mechanisms, turn it into personalized through conversation, through what do you need? But how can we teach physicians at a larger scale and patients at a larger scale? And bridge the gap because you're saying it. The need is here and the science is here. We just need to build this bridge. How can we position ourselves in a business perspective building this bridge? What comes to your mind? Feel the body, feel the emotions, and let them inform our creativity, right, Teja? Because this is something that we feel deeply.
I think the first thing that comes to mind is people go likely into a position where they're caring for patients because they want to help. And like you are saying, people don't know what to do with FND. I think it can be almost scary to see a patient like experiencing what a patient might experience in FND and to not have a scan that could explain why and to not have things that you as a person who wants to help people who are sick or suffering to have an easy answer. And so I like a lot about what you're saying about giving physicians more of a sense of control, not control like I can control the patient, but that I have things that I can do to help. And I think that might be a part of, there's sometimes a divide between FND patients and providers where there feels to be resentment sometimes on both sides. And I think a lot of that can stem from patients want help and FND providers who might be seeing FND patients may want to help but can't. And that is a very emotionally exhausting position to be in if you're not given any resources to actually help. And you have other patients that are waiting that you might have the tools and resources and education to help. And so that kind of sets no one up for a relationship in which anyone gets helped and anyone feels grateful or like it was effective care. Um, and so it's not really on either party what is happening. Um, I will say that currently in pharmacy school, um, and I think there was a study that F&D Hope partnered with as well that demonstrated this, that when medical students are on rotation, and I go on rotation as well, a big part of how medical students and healthcare students learn is through their preceptor and watching interactions with patients. And that kind of empathy is something that is kind of observed and then learned. And I'm not talking about even the care they're providing, but also just how the interactions are done with patients and kind of conversations that are had without the patient in the room about the care you are providing to the patient. And that's almost a cultural thing. And so um, it's a challenge because we can increase education about functional syndromes and things like that in lectures, in, for medical students, for psychology students, things like that. But there's kind of a cultural barrier that, there's historically been stigma, and some of the practicing providers right now, they might observe and pick up kind of some more stigma or maybe reservation about treating these patients. And so one of the things that I think is amazing that you do is if we amplify the voices of the people who feel comfortable treating FND patients and who have had success treating FND patients, I think that to me is going to be key, right? Because that takes away that, oh, I have to be kind of reserved or nervous because, I don't know what to do and I don't want to mess up. And, this is not something I can treat. Well, if we take the people who can treat them and kind of set the example, I think that holds a lot of promise. In addition to, starting education earlier and not having your first FND patient, you never had a lecture on it in medical school and you're just meeting for them for the first time in residency, right? That is not setting anyone up for success. But I also think it's not just going to be like through learning about mechanisms. It's also got to be amplifying and demonstrating how to interact with FND patients, how to provide those treatments, and how to kind of conceptualize those interactions, and especially delivering the diagnosis. I think there are neurologists who model that very, very well. I think Dr. John Stone did an entire seminar on it this summer in Boston. And I think if more neurologists had access to seeing actionable ways to do things, I don't think it's lack of will on their part. I think they'd be very grateful.
Yes, I totally agree. Education has to start early in medical school and through our residency. And we also need to start looking into and implementing primary prevention at home. At the home level, right? We need to start preventing and start teaching in homes. This is a new program that I develop in Europe now, where we go to the houses and we identify in parents who have the disorder, the illness. We identify the mechanisms that the dysfunctional mechanisms that the parents are teaching to their kids subconsciously. So there are,
yeah.
yeah, so we are starting to look into primary prevention and also secondary prevention, not to have those relapses. The experiential education for family members is also important, because you said your family had a key role. So medical school, residency, physicians who are already graduated, attending, working, they also need to be trained. It should be mandatory. The ABPN and all the boards, the medical boards in all the countries should make this mandatory. My current paper that have been submitted has a lot of medical, social, legal activism, because we need to start knocking doors up high. This education needs to be mandatory. And then training the family. And let me tell you, in the experiential education program that I put together for professionals, Teja, it's very experiential, right? Doctors, they were nervous, they were shaking, they were talking about their fears, about their incapacities. And then it's a matter, we have to truly pay attention to these uncomfortable ways of feeling, and it has to be a change from within. It has to be, the doctors need to feel the change in their bodies. Is what you said. The stigmas are very ingrained, so to renew, to change the healthcare system, it cannot be only cognitively through one or two lectures. It has to be also felt, it has to be emotional. So I totally agree. We have a few minutes left. Where do you want to take the conversation? Where do you feel in the body, in your emotions? Like, should we take it another optimistic step and maybe brainstorm something that we could do? And should we take it into the emotional realm, or should we take it into another, like pointing out more problems? What did you feel, Teja, personally? What would satisfy you? What would make you feel that the conversation has been nice for you too? Because everything starts personally, and then we can change the world when we are well within.
Um, I think one thing I really liked about what you said about primary prevention is that, someone might not have a functional condition like FND, but most people, I garner all people in their lifetime experience functional symptoms, right? And there are people at higher risk and things like that for it developing into more of a life-altering condition. But that if you institute things like primary prevention, and this doesn't necessarily have to be in a care environment, right? It can be in education, it can be in kids' sports, but there is a lack, kind of like what you were saying, of acknowledgement of things like emotions and things like that. We are a very cognitive driven society. And I think for people like me, um, I would have really benefited from that stuff being integrated into, say, my education, like especially in elementary school. I was a hot mess, but the solution was not necessarily to give me the support that I needed, but more to just push me more towards academics, right? And in sports and things like that, like we have an opportunity to show people and kids how to regulate, how to listen to their bodies, how to also have more autonomy. And so I think while it's very easy to say, like, oh, F&D patients lack interoception and regulation and all these things, a lot of people aren't set up to have those kind of naturally in them because they're very busy. They have a lot going on. They're taking on a lot of responsibilities. And that side of maturing and growing up is often overlooked. At least I think, and this is not a commentary on my parents or my education, but I think it's just more broadly that that's no longer perceived as important. And it's something that I've seen not only in FND patients, but just in people in my life generally. Like once you leave home, you have to do a lot by yourself. And it's more than just showing up to a work meeting on time and prepared, right? It's also taking care of yourself and checking in with yourself. And I at least didn't get a lot of people teaching me how to do those things. Um, and so um, it's something that could really benefit everyone. And also, in terms of primary prevention, this is more secondary, but identification of people who are starting to experience functional symptoms and giving them resources to help instead of just saying, like, oh, labs are reassuring kind of thing. Because the symptoms aren't too dramatic, we don't need to do any like more interventions. But then waiting for them to become so extreme that it doesn't matter that labs aren't reassuring, right? So I think that is also key, right? Just because you've confirmed someone's not having a heart attack and they know not to come back to the ER if they have chest pain with anxiety, maybe give them resources to help with the anxiety. And not only are they less likely to represent, but even if they weren't going to represent to begin with, they'd likely benefit from that experience.
Totally, totally. And bright minds think alike because I was in Spain and I stayed at the home of a patient and he was his wife and we designed all these new programs. Primary prevention is starting in schools. We went to universities, we went to schools. Yes, Tesha, this is key. And I invite you personally here and everyone who is coming across this video in due time. Let us work on an international campaign on primary prevention and on continuing teaching doctors and bringing the amazing science and mechanisms that are being out there. You know, I think I have it open. It's like what we teach, what we have been talking about, what we spread is the mechanisms that great researchers like John Stone and all the other wonderful have been described. It's like teaching about the mechanisms that are in the neocortex, cognitive mind, the limbic emotional system, the autonomic nervous system, and the somatosensory body inserted in society starting from school and childhood and all that. So let us work on that international campaign at all levels. I think it has to be a little bit of a strategic planning and design, inviting other patients who have become experts, educators, and understanding because no one knows the dysfunction in such a deep and comprehensive manner as those who have experienced it in their bodies and who have learned about it. Because you're right, we all experience a little bit of back pain or neck pain or headaches and dysfunctional symptoms throughout our life, but it's the ones who dedicate time to learn and understand and talk about this wisdom who know many times more than doctors. Right, we know from the inside out. So I invite you and others to join us, to communicate, to send emails, to say, like, yeah, let's work on this international global campaign on prevention and healing through education. What else in the final minute? Anything else that you would like to share with the public out there?
Um, I think on the note of stigma, there's a lot of debate going on right now about, is FND neurological, is FND psychological? What should the terminology be for, I think, currently functional seizures, right? And there's a lot of divide that's happening. And I think the message that I hope to embody is that it shouldn't matter. And that like it doesn't matter if it's neuro, it doesn't matter if it's psych, it doesn't matter if it's cardio. What matters is patients are getting the care that they need to feel embodied, right? It shouldn't matter if it can be seen on a test or not, right? Because they are experiencing the symptom. And, for me, I will acknowledge like I did have like psychological risk factors that, in my opinion, definitely contributed to my onset. And it doesn't matter. Like I was still experiencing the symptoms that I was experiencing, and that someone else who might not have psychological risk factors or things like that is equally experiencing the symptoms and is equally suffering. And both of us might have FND, but different kind of reasons or experiences. And that everyone deserves holistic care that's multidisciplinary. Um, and yeah, I don't think we should let stigma kind of constrain patients. And I'm noticing that a little bit in the patient community, people are kind of constraining each other. And that's not to say that patients aren't belittled or diminished or like, what's the word? Maybe dismissed by doctors saying it's all psychological. And it's not. But I think it's critical that we move beyond what is it and more just how do I move forward to get better? And that it might mean psych, it might not mean psych, but at the end of the day, all that matters is that you have an understanding of yourself and how to move forward. And so, if it is psych for you, that's okay. If it's not psych for you, that's also okay. But I'm getting like, we don't need to keep having that conversation because all that matters is that patients feel heard and get better.
Yeah, exactly. And we all have a mind and a
Mhm.
psychology. We have a body, right? We have all these parts of ourselves. Let's embrace it all. And
Yeah.
let's see how we can live well within ourselves in society. I totally agree with you, Teja. These are lovely, lovely final words. Let us see. Our next, we have two more conversations left. The next one is about kind of a summary on the F&D Society meeting that took place last year. And we're going to do that in preparation for the next meeting. Maybe we meet again in the next meeting. So the next conversation is about that. And then we have another one. The final one is going to be goals and aspirations. So we have two more conversations for the series. We invite everyone to stay connected. And until next time, right, Teja?
Thank you.
Thank you. Thank you, everyone.
Thank you.
Hello, Teja.
Hi, how are you?
I'm okay. How are you? Nice to see you. Long
You too.
time.
I know it's been too long. I'm sorry.
Me too. I've been so busy and
Yeah.
tired too, right? It's like we do a lot of things and then we need to rest a lot because the energy gets
Yeah.
so like wiped out.
I think the winter weather's hitting me harder this year. I don't know why. I always get like more tired when there's less sunlight, but it's definitely hitting me harder this year. So I'm trying to get outside more.
Yeah, and I think it's normal, right? Like we're aging and we have so many responsibilities and
Yeah.
projects. So it's really like it consumes our energy. I feel it in my body like every decade. I am more tired. I'm no longer like in my 20s. How old are you now?
I'm 22.
You're no, you're 22. Yeah. Yeah, but no, I have noticed it in my 30s and now in my 40s.
Yeah.
And
It's a
you're right,
natural process.
sunlight. Sunlight makes a big difference. It makes a big
Yeah.
difference. Okay, so let's since it has been a while since we did one of these, uh now when we get started, tell us again like what you're doing. I think it's already recording actually.
I
Yeah, it's
saw when
already
I joined,
recording.
it was like recording in progress, but I don't know if you need to cut because there was like a bit where I was just sitting here.
Yeah, no, I will
Okay.
edit. I will cut this piece. Okay, are you
Oh, okay.
ready to start? And then
Yeah,
I'm gonna
sure.
ask you to introduce yourself again for like a refresher. Like, what are you doing? Like, what are you working on? And volunteering and your studies and all that. And then the topic is current care and treatment options. And
Mhm.
then we'll get it from there. Okay, 1, 2, 3. Here we go.